Psychiatric ward nurses. What did a patient do that left them speechless? I'm not in a mental health ward, but I used to sit with patients in the hospital who were fall risks or a danger to themselves/other people. I had many crazy nights. They kicked me in the knee, wiped my ass, peed on me, punched me. Just the good old days. The worst was back when I first started, and I was sitting with this sweet old lady. I had sat with her talking about her family and such for 6 hours. Toward the end of my shift at 9 p.m. they decided she didn't need to have a heart monitor, so they moved her to a different unit. Once we got to the new room, she started acting differently, just angry, I'd say. Then all of a sudden she tries to jump out of bed. A big no-no in hospitals. So I immediately got up to stop her. She starts screaming at the top of her lungs about how her house was on fire, and her family was inside and I needed to get them out. I tried to calm her down but it was in vain. She screamed the whole time. She starts telling me how I'm going to rot in the flames of hell because God told her to, and how I was responsible for the death of her family. Looking deep into my soul, she tells me everything about burning in eternal flames and I'm filled with evil. I think, well, at least she's not worried about her family or trying to get out of bed. Then she starts screaming at the top of her lungs in what I can only describe as Latin languages. At this point, I'm scared, but mostly angry at the staff for not going in to see this old woman. She then yells out her false teeth, throws them at me, and then pulls all the skin on her face back in a long, stretched, creepy smile and lets out a heartbreaking scream while her eyes roll back like in a possession scene from a movie. Just as my mind calms down. Relief. He enters the room. I wish him luck and I run out of there. The second I left the unit, I called my mom and cried for 15 minutes. I still think about his stretched out face sometimes. Once. Less terrifying but more creepy. I was sitting with a man maybe in his 30s who thought he was in a Steven Spielberg novel in room 402 or something. And unfortunately, his room number was very similar. At first, he thought I was his psychologist or something because I was holding a clipboard while I talked to him, so he was telling me all his crazy thoughts and wondering what I was thinking. Trying not to upset him and make him burst, I played along, nodding, and when he asked my opinion, I would turn to him and ask him what I thought about it. This worked until the last hour of my shift. Then he looks at me and says, "You can be the next Messiah. Come here and leave me. Teach you by patting the bed next to him." I try to politely decline, but he insists a lot. But I'm not crazy and there's no way I'm going with him, so I just keep trying to gently tell him no. Then he goes silent for a moment and says, "I see," then proceeds to take off his oxygen, his heart monitor, then tries to take off the fourth one. When I call the nurse and try to stop him, I ask him why he's doing these things, and he looks at me and says, "I can go now. My task is complete. You will not accept my training, and now I can die in peace knowing that I tried." The nurse comes in and practically trash talks this guy in a joking manner to make me look less messianic, since once again my relief comes in with perfect timing for me to escape. If you're enjoying it, subscribe. I'm not a nurse, but I worked at a group home for teens, and one ended up in a psych ward. She was a sweet little girl. 15 years old, she had been there for about 3 weeks. She had plans for the future. She would be staying with a relative she liked. Within a week, she had friends and no history of any problems at all. Aside from her mother kicking her out of the house for having a boyfriend, she was understandably upset. She went from sane to broken overnight. It was around 1 a.m. when I found her awake during checkups, sitting up in her bed, looking upset. She had convinced herself she was pregnant, even though tests said otherwise. Then the baby had been switched with chemicals. She was terrified of the baby inside her and the chemicals everywhere, changing everything. We couldn't get her to realize she wasn't pregnant. She couldn't be. She kept talking about chemicals, but it's hard to know exactly what she was referring to: cleaning products, pollution, medications she wasn't taking. Of chemicals. That got into things the same way some people talk about it. Totally strange but still just a little alarming. Then the clock started talking to her and telling her what to do. Some of the things it was saying involved burning herself and banging her head against a wall. That's when we called the authorities. Then she basically became incoherent in a word salad sort of way and wouldn't respond to us, even when we stood between her and the wall she was banging against. It was like we weren't there for her. When they brought her in about 4 hours after the first strange statements about how she was suddenly pregnant, she was in a manic state, but also strangely passive again. As if we weren't there, and she couldn't walk. They had to carry her out on a stretcher. Mentally, she was somewhere else entirely. It was terrifying to watch her break down so quickly and completely. If working in a psychiatric hospital has taught me anything, it's that they can't deceive you. You can see someone sitting calmly in a waiting room. Wait and assume it's a visitor, someone ordinary. But the reality is that many of those people hide within storms that one could never imagine, and some of those cases, stay with you forever. I worked in the psychiatric unit of a hospital for more than 10 years. During that time, I learned to detect when a patient was pulsing, when they were faking, when they were just seeking attention, but I also learned to differentiate when someone was truly lost in their own mind. And Betty was the patient who made me question everything. When I met her, she didn't seem at all out of the ordinary. She was an elderly woman in her 60s with a sweet, calm voice. She had the appearance of any grandmother you might find in a store, shopping for things for her grandchildren. She wore her gray hair perfectly combed and always had a kind expression, almost as if she were one of those people who had never raised their voice in their life. I remember ours perfectly. Our first conversation was a quiet morning. Without many incidents on the unit, I approached her while she was drinking in the common room, and we started chatting. She told me about her house, the wooden furniture she had in her living room, and how she loved decorating it with old photos. She told me about her children, although at one point she fell silent, staring into space, as if she were remembering something she didn't want to share. And her grandchildren, I asked her with a smile, trying to lighten the conversation. She was silent for a moment, then smiled. "Oh, my grandchildren, yes, my grandchildren. They love gingerbread cookies. Every time I saw them, I baked them some." I didn't think much of it at the time. It was a calm conversation. Nothing unusual. She seemed lucid, calm, even warm. If someone had asked me at that moment, I would have said that Betty was a patient who probably didn't need to be there. She seemed normal, completely normal. I was wrong. A few hours later, I was at the nursing station. I was talking to a colleague when I mentioned how nice Betty seemed to me. My colleague looked at me with a strange expression. Betty laughed, but it wasn't a laugh of amusement, it was a laugh of disbelief. "Which one did you talk to?" I frowned. "How come the one I talked to turned serious? She told you about her family, her house, her grandchildren." I nodded slowly, not understanding why that seemed so important. My colleague sighed. "Look, Betty has dissociative identity disorder. It's not always the same person. If you talked to Betty about the grandchildren, you were lucky. There's another one who isn't as nice." I felt a chill run down my spine. It wasn't the first time I'd dealt with patients with multiple personalities. But there was something about the way my colleague said it that worried me. "What does the other Betty do?" I asked in a low voice. My colleague was silent for a moment, then, without changing her expression, said, "Does this happen?" 2 weeks later, she tried to suffocate a nurse with a pillow. I didn't remember anything afterward. I swallowed. Suddenly, the harmless conversation about cookies and furniture took on a completely different meaning. The image of Betty smiling with her cup of tea felt like a mirage. She was the same person. Yes, but at the same time, no. The following days, I began to observe her more closely. Some mornings, she was still the sweet older woman with stories about her family. But other times, I would see her sitting in a corner, staring off into space, whispering to herself. There were times when her voice would change completely. It wasn't just her tone, it was the way she pronounced the words, the intensity with which she spoke. Sometimes she would slouch. Other times, her gaze would become sharp and calculating. One day, as I walked down the hall, I heard screams from her room. I immediately went in and found her in a corner whispering something while holding her head with both hands. "No, no, no, no," I approached cautiously. "Betty's fine." Her eyes suddenly found me, but something in them wasn't the same. I had seen days ago. "Who the hell are you?" Her voice was different, deeper, more aggressive. "I'm the nurse on duty," I answered calmly. Although my heart was beating rapidly, she stared at me for a long moment, then smiled. But it wasn't a friendly smile, it was a crooked, almost mocking smile. "You're new here, right?" Before I could answer, her expression changed again. Her posture relaxed, her gaze softened, and from one moment to the next, she was back to being the same friendly Betty as always. "It's cold here, don't you think?" she said in a calm voice. I took a step back. In less than a second, she had gone from being someone dangerous to a fragile, cold old woman. That night, while I was trying to sleep, I thought about her. I thought about how easy it was to trust first impressions. I thought about how in a matter of seconds, someone can transform into a completely different person. I never spoke to her again like I did the first time. I couldn't help but feel a knot in my stomach every time. I saw her in the common room drinking her tea as if nothing had happened, but I watched her from afar. I saw how sometimes she was completely calm and how other times she stared at the other patients with a calculating expression, almost analyzing who her next target would be. Days later, Betty was transferred to another unit. I never knew where exactly, but I heard rumors that she had been put under observation after an incident. No one said exactly what happened. I don't know if she tried to hurt someone again or if it was just her state. The only thing I know is that since then, every time I meet someone, every time I have a conversation with a new person, there's a part of me that can't help but ask who I'm really talking to, and that thought, more than anything else, is what keeps haunting you. A call for help getting the man in the hat out of the room. The room empty, no other man, no hat. Just him, getting angrier and angrier because this man. Creepy, he won't leave the corner of his room and apparently alternates between talking to him incessantly and just staring at him. He was heavily medicated and had a history of hallucinations. He died a few days later. Fast forward a few days, the first night we have a new patient in that room. I get a few additional calls, and this patient is less angry and generally in a better state. She says she's settling in well, but I just wanted to know who the man was earlier because they were having a great conversation. But he left. I'd forgotten about the man in the corner from the week before. So I thought it was the staff from the previous shift trying to be helpful. I asked him what he was like when he said he couldn't quite remember because it was so dark where he was in the corner, plus his hat made it a little difficult to see his face. My hair stood on end remembering the man from a few days earlier, pointing at that same corner. To this day, when I think about it, I get goosebumps. Next story, I just retired as a psychiatric nurse in San Francisco. I've worked with many mentally ill patients in the city since 1983 and have experienced many things. During that time, I was working at a psychiatric emergency clinic around 1984 or 1985, and Ronald Reagan was visiting the city for a one-night convention. A patient who had reportedly threatened to kill him was brought into the clinic for observation. During the visit, he was accompanied by Secret Service personnel, as well as his therapist. His therapist was a very thin, quiet, blonde young man from Colorado, dressed all in black. The staff told me he had a diagnosis of multiple personality disorder, which is an extremely rare disorder that many professionals don't believe actually exists. I had doubts. He sat in the clinic's waiting room for most of the night. Occasionally, he spoke so quietly to his therapist that he was almost inaudible. Then he went to bed in one of our seclusion rooms when it got later in the middle of the night while I was doing checks. I walked into the room. And I guess he was a very light sleeper because he sat up in bed and said something. I don't remember. What was strange was that I swear the person who sat down was a completely different person from the patient I had witnessed in the waiting room all night. Everything about him was different, the muscles in his face and his expressions were completely different. His body posture had completely changed, and even his voice was much more aggressive and deep. I remember apologizing for waking him up and leaving the room. But I could actually feel the hairs on the back of my neck rising because this guy was markedly different from what I had experienced with him in the waiting room. That incident has always stuck with me. Next story here, a psychiatric pharmacist, not a nurse. There's always one patient who comes to mind when people ask me this question. We had a guy who, about 3 years before I arrived on the ward, jumped from the 6th floor of an apartment building. He completely ruptured his aorta, a large artery in his heart, and in the process caused significant damage to his leg. Somehow, he was miraculously saved through immediate heart surgery and stabilized. The first time I heard of this guy on the ward was when I saw one of our nurses in full gowns and a face shield. I had never seen this before in a psychiatric ward. He spent a year with one-to-one vision, going through periods of hunger strikes and total refusal of his oral medication. He would request injections of medication to calm him down. Every time the nurses came near him, he would squirt all his bodily fluids. I could find, explaining the face masks and singing at the top of my lungs, which caused some distress in other patients. The only time he engaged in any kind of nonverbal conversation with me was about prescribing him high doses of opiates. He had a long history of illicit drug use and was constantly asking for more. It was difficult to weigh how much pain he was in versus how much his drug-seeking behavior was. Needless to say, at that point, his leg was damaged beyond the point of repair. He had developed osteomyelitis, a severe chronic bone infection. After years of opening the wound and smearing it with his own bodily fluids and placing objects there, it somehow wasn't turning into full-blown sepsis, but we always knew it could happen any day. I was involved in a meeting with the surgical team who suggested that at that point, Their best option was a complete amputation of his leg, including the removal of part of his hip to eliminate the infection forever. Sometimes he accepted this, almost seeing it as an extreme form of self-mutilation, and other times he simply remained silent when asked about it. In the end, we discovered that it would take around 8 operations to do this successfully in a healthy person, and there was no way he could do it without manipulating the wound while it healed. And so on. One of the hardest decisions we made in that room was to leave him as he is, with chronic infections and ongoing mental health issues. In the end, he went into a long-term placement, and to this day, I always wonder if he's still alive and kicking.